solid plan of increasing testing right across this province, but we should never sit back. This can come with vengeance.
I found it a little bit surprising that the numbers are actually going down rather than going up.
The experts say testing is the key to fighting COVID. So why is Ontario actually carrying out fewer tests for the disease? Public health experts want to see more testing done for COVID-19, but right now Ontario is actually doing less testing day after day. It is leading to concerns that the province doesn't have a true picture of the spread of the virus. Queen's Park reporter Mike Crawley has the story.
In the fight against COVID-19, widespread testing is a crucial tool.
I think if we can identify more of the cases that are in the community, it will help us give us a better idea of what's going on.
But here in Ontario, testing has largely been limited to people who've traveled outside the country, so that hospital patients, nursing home residents, and healthcare workers get priority.
It's possible that there are more people out there who have this infection that we're not aware of, and they may be spreading it onto their contacts.
After exceeding 6,000 tests per day a week ago, Ontario's numbers have been steadily dropping, with little more than 2,500 test results produced today.
And so I am a little bit concerned that we don't have a very good handle of what's happening with this epidemic right now.
Less than 2 weeks ago, Ontario's labs were overwhelmed with thousands of people waiting days for their test results. That backlog is now cleared with help from private labs. The province can now process 13,000 tests a day. Why is it still testing so few?
The assessment centers are testing more and more of the people that are showing up, but we're encouraging them if the people who show up have symptoms and there's some concern, the capacity issue isn't what it was, they should be testing.
Ontario is testing a far smaller portion of the population than any other province.
Yes, number one, we have a responsibility to ramp up capacity so that we can get a better tools for our response and a better picture of the epidemic.
The health minister promises more testing of the most vulnerable soon, including residents of nursing and retirement homes.
We have developed a strategy in order to be able to increase that testing there.
Another sign of how narrowly Ontario is testing for the virus, nearly 15% of today's tests came back positive. That's a far higher rate than in the rest of Canada. Mike Crawley, CBC News, Toronto.
27 residents of the Pinecrest nursing home in Bobcaygeon have now died from COVID-19. Today, the health minister was asked about a CBC News report that Pinecrest didn't separate healthy and sick residents or staff until 2 weeks after the home declared a respiratory outbreak.
This is something that is being dealt with by the local public health units, that they went in as soon as they found out what was happening, and they have been working with them ever since to make sure that the proper testing is being done, that the proper isolation is happening, and that if any residents need to be taken to hospital to be on ventilators, that is happening as well.
Efforts to move people to isolated parts of the nursing home were apparently hampered by space constraints. By the time that separation took place, 16 people had already died at Pinecrest. Minister Elliott said today testing in long-term care and seniors' homes is being ramped up. Opposition leader Andrea Horwath is calling on the provincial government to make immediate changes in the long-term care homes.
Aggressively recruiting home care and long-term care staff. Mandating that more staff be scheduled on each shift in each long-term care home. Immediately increasing salaries for staff to a minimum of $22 per hour in order to retain and attract workers, including personal support workers and registered practical nurses. In COVID-19
Horwath also wants each staff member to be assigned to one facility only. She also wants to see long-term care providers wear protective gear whenever they are with residents. The province has announced a new online portal to match skilled frontline workers with healthcare facilities.
We've heard from so many healthcare professionals out there. They've been calling us, they've been writing us, they're asking, how can I help? They don't want to sit on the sidelines and watch as this virus spreads. They want to get out there and make a difference. and we need them.
The Premier went on to ask anyone with medical training to sign up through the portal, saying the province and the people of Ontario need every person that's available to help, whether that's on the front lines or in another area of the healthcare system. The health minister said the province is exploring whether they'll accept doctors who received training elsewhere, something the mayor of Brampton says is critical.
The fact that we have 14,000 foreign educated doctors, according to Health Force Ontario and the recruitment agency, speaks to the fact we've got this awesome arsenal of talent, ready, willing, and eager to help keep us safe. And I think we can learn from other jurisdictions. If you look at the state of New York and New Jersey, they have taken this approach. They have welcomed foreign-trained doctors into this battlefield of fighting COVID-19.
Brown sent a letter to the province calling for the government to facilitate transitioning foreign doctors to the front lines. He believes it will save more lives and fill the system with more capable hands. If you are trying to call Telehealth Ontario, you might be waiting not hours, but days. That's what some people are experiencing when they call the service. So the province has suggested contacting your family doctor instead. But what if you don't have one? Lisa Shing has more.
I kind of thought maybe it was my appendix, given all the symptoms I had.
When Rhea Lip called telehealth last week with stomach pain and a fever, she was told the wait for a callback from a nurse was 4 days and 10 hours.
I was really shocked because people, who call telehealth kind of depend on talking to a nurse and getting a nurse's opinion, especially at times like this.
Others online complained of similar wait times when calling the service. The province says the current average wait time for COVID-19 calls is about a day, while the wait for other health questions is about 2.5 days. That's after adding more than 300 nurses and 100 intake staff. The advice of provincial officials.
I think right now, for people to call their own family doctor is probably a more timely way to deal with it.
But what about 1 million Ontarians who don't have a family doctor, or those whose family doctor's offices are closed, or those who live in remote areas?
Thousands of physicians have signed up for virtual care.
And there's a broad range to choose from. There's the not-for-profit Ontario Telemedicine Network that does consults with people regardless of whether you have OHIP coverage or a family doctor.
There's gaps in the care in all provinces, but Ontario no different.
There's also the app you can download, CloudMD, that's covered under OHIP.
These are services that are really important right now as we're all trying to social distance and isolate. And again, the virtual care really provides that opportunity.
Or there are walk-in clinics that are now assessing patients over the phone.
We get calls every morning and we get to them the same day.
The issue with virtual platforms and walk-in clinics is you may have to research their hours of service. The Ministry of Health says you can also call your local public health unit for advice. Lisa Shing, CBC News, Toronto.
Around the world, demand is outstripping the supply of protective gear and critical medical equipment during the pandemic. Prime Minister Trudeau says Canadian companies are making progress in providing innovative solutions of their own.
We're working with Thornhill Medical, CAE, Ventilators for Canadians, and a group led by Starfish Medical to produce up to 30,000 made-in-Canada ventilators. Autoliv is looking to make medical gowns out of material they'd normally use to produce airbags.
The Prime Minister says the Canadian-made ventilators can be ready in the coming weeks. Production is also underway of Canadian-made face shields and masks of all types. Trudeau says while he hopes Canadians won't need all that is being produced, it will help in other parts of the world. After saying yesterday that healthcare workers will run out of personal protective gear in a week, Premier Ford is now saying the situation is getting better. Today he toured a Vaughan factory that has switched from making auto parts to masks.
It's a very, very different product with different specifications, and it's really been the access to these tremendous scientific and engineering minds that really have allowed us to understand what the need was and how we can convert some of our existing infrastructure to be able to make these masks.
The Premier thanks staff for their contribution to the fight against COVID-19. Ford says the Woodbridge Auto Group's factory has received approval from Health Canada to manufacture the masks. At the end of the visit, Ford and factory employees loaded up the Premier's vehicles with 1,000 masks for distribution. We are learning the City of Toronto has now recalled over 62,000 surgical masks that were distributed to staff in long-term care homes because they do not meet the city's health requirements.
We are conducting an investigation to determine how many employees may have used these masks and if there was possible exposure to COVID-19 as a result. The masks are being returned, and the vendor has committed to a full refund.
The masks, which cost the city more than $200,000, were faulty, with reports of them ripping and tearing. The city is trying to retrieve new masks to make up for the loss and have asked the province to help expedite this. The city is also undertaking a quality control review of the supply chain, making sure all future orders of personal protective equipment meet the city's requirements. More and more people are wearing masks and gloves while they are outside to protect themselves and others from the virus, but many of that protective gear is being thrown on the ground, littering our streets with possibly contaminated protective gear. Greg Ross explains.
If you dispose of gloves or masks, again, you could contaminate so many different areas and people on the ground.
The Premier addressing something that is a growing concern in Toronto. Discarded gloves and masks turning up in public spaces like sidewalks and parks.
You know, no one wants to go around seeing a used glove. You don't know what it's been used for.
Anna Banerjee is an infectious disease specialist at the University of Toronto. She says the chances of discarded gloves and masks being infected with COVID-19 are extremely low, but it's still a possibility.
So theoretically, it could live. For a mask, it could be a day. For a glove, it could be a couple of days.
But even if they are not contaminated, she says just seeing them can be stressful, especially considering we are living in a time when tensions are already high.
I think the biggest danger is the fear that it creates when people are thinking that I could get COVID from these discarded masks and gloves. Or if a toddler taking something like that and sucking on it, that would be really stressful for any parent.
While it's understandable that people would want an added layer of protection when out in a public space, the city says it's still important to remember to discard these items properly.
It's litter, and so gloves and masks, those types of things that people are wearing and want to dispose of them, put them in the garbage, put them in the litter bins around the city, put them in your garbage at home.
The fine for littering in Toronto is $500. Greg Ross, CBC News, Toronto.
Mayor Tory is also asking people to stop donating clothing at charity bins around the city, and it is very easy to see why.
I admire and I thank you for the fact that you care about your fellow citizens and make these donations, but right now the bins and the city is in no position to see those donations accepted. And in fact, you might argue that they will never end up reaching the people that you're trying to help. So I'd ask that you stop that. It's not good for the environment, and it's not good for getting donations to the people who need help. As for those who took advantage of this situation to leave garbage beside these bins, if you're caught doing this again, if people continue to do this, you will be charged and you'll be fined under the appropriate provisions, and I think that is something that you would richly deserve.
Passover and Easter are both being marked this weekend, and Ramadan is coming up later this month. But with the COVID-19 pandemic, the city is asking residents to change their traditions.
Look ahead to these holidays this weekend and decide that you're going to stay with the people you're living with, not visit other family members, not have them visit you, not have people come from out of town, not to go out of town, just to stay home.
Thank you. The city is urging residents to find what it calls creative ways to connect with family. Yesterday, the mayor also said residents should do their grocery shopping as soon as possible in order to avoid the possibility of larger crowds closer to the weekend. And Colette, the little ones are worried about what this pandemic means for a certain Easter tradition that's coming also this weekend.
Yes, I know all about it. And Dwight, I'll tell you, I have some great news. So I have to actually interrupt the weather headlines because I have been in contact with the Easter Bunny. So kids, did you hear this news? Yes, the Easter Bunny tells me I'm essential. That's right. Premier of Ontario, Doug Ford, has declared not only the Easter Bunny as essential, also the Tooth Fairy, but the Easter Bunny's services. So that means the delivery of your chocolate eggs and your candies and your baskets and those Easter egg hunts. Those are all still a go this coming weekend. It's just important, you know, that we make sure it's not done in public parks. We're using our own backyards or whatever you have available to you and keeping it within your close-knit family or those that you live with. But it's still on, so that's good news. Hey, today our temperature up to almost 14 degrees, 13.6 at about 2 o'clock. And then with some showers that have been pushing through the GTA, temperature coming down a little bit, sitting at 9 now. You can see how they're somewhat spotty in nature, but this is going to be filling in a little more significantly as this system works its way in through these evening hours. The odd thunderstorm, not out of the question, seeing a few of those, a better chance of it back towards southwestern Ontario. As this carries on through the overnight, we'll get some breaks in the precipitation, some fog developing. So for our frontline workers especially, there may be some reduced visibility. If you're working shifts, you're going to be out there on the roads. Just know there could be some reduced visibility. I want you to really take it easy through the overnight hours. That fog will last till tomorrow morning, and then that'll ease out. Showers will end. A few could still be lingering in the morning, but they'll move out, and we'll get some clearing into the afternoon hours. And then it's going to be on Wednesday night, the next system, and that's a stronger one that's going to come through. So we'll spend more time on what it's going to do to our temperatures. That's coming up. But tonight, 5 degrees the low. Tomorrow, still mild, Dwight, 14 degrees.
We'll take it. Thank you, Colette.
You're welcome.
The weather update is brought to you by Train, the most reliable heating and cooling brand. It's hard to stop a train.
The COVID-19 outbreak has forced businesses around the province to close down. Today, the Royal Ontario Museum announced it will be temporarily laying off some employees. In a memo to staff, the ROM says they likely won't reopen to the public until the end of June or possibly later. The museum's director called the financial impacts sudden and profound, adding that without ticket and retail and food sales, they can't fully support salary costs. That means some employees will move to a reduced work week. Others will need to take a temporary emergency leave of absence. Full and part-time staff will be paid until this Friday. Executives at the ROM will be taking a 20% pay cut.
To be in my apartment and to be able to step out onto a balcony and get some fresh air is one of the most amazing things that could be happening at this point.
She is happy to be on dry land after being on board a cruise ship that had a deadly COVID-19 outbreak. How she stayed hopeful during the harrowing experience, next. We are hearing tonight from a Toronto woman who was on board that Holland America ship that experienced a deadly COVID-19 outbreak last month. The MS Zandam couldn't find a port in South America to let passengers off, so it stayed at sea for almost 2 weeks. But amid all that uncertainty, Nancy Thornton says she found plenty of reasons to stay full of hope. Mike Wise shares her story.
It's a little more emotional now when I'm starting to process all of this. But I am so happy to be home and to
This was the day Nancy Thornton was supposed to be returning home from a once-in-a-lifetime South American cruise. She boarded the Holland America Zandam a month ago in Buenos Aires, but less than a week into the trip, passengers were told to stay in their rooms after several guests and crew fell sick.
A quarter of the crew ended up ill on the Zandam. So people were doing things that weren't part of their normal job description.
The cruise line gave passengers internet access, which many, like Nancy, used to keep in touch with family and friends back home. With no ports willing to let the ship dock, the cruise line had to restock at sea using tender boats, later transferring healthy passengers like Thornton from the Zandam to her sister ship, the Rotterdam. She knows in hindsight there are probably a lot of things the cruise line could have done to avoid this situation, but she thinks the crews of both ships did the best they could.
They had to adjust almost hour from hour to how the circumstances were changing. You know, who was still had an open port, who had just closed their borders. Were there going to be flights home?
Eventually, both cruise ships were cleared to go through the Panama Canal in order to head back to Florida. Once they were in the Atlantic, she says her ship's captain gave an inspirational and comforting speech over the intercom. Nancy wrote down the words.
He says, "Today, I choose peace over chaos, respect over contempt, thoughtfulness over reaction, faith over fear, and others over ourselves." And that kind of brought us all together and said, you know, we're in this together.
The boats returned to Florida last week, met by armed Coast Guard ships. But Nancy says what she remembers is who else was there.
But behind all those armed men were people on the shore, and they were out there and waving at us. They had flags that they were flying for our behalf, and they were cheering. And it was such a contrast.
She flew home last Friday after health officials cleared her to leave the ship and is now self-isolating for 2 weeks. But after a month alone in a room with just a window on the ocean, she's glad to be home.
I mean, just to be in my apartment and to be able to step out onto a balcony and get some fresh air is one of the most amazing things that could be happening at this point.
Mike Wise, CBC News, Toronto.
A month alone in that cabin, incredible. While doctors have said those who are older in age are most vulnerable to COVID-19, the virus has proven to be deadly amongst younger people too. For a couple in Toronto, contracting COVID wasn't even on their radar. They hadn't traveled and were enjoying a night out in the city when they got the virus. They spoke to CBC earlier today.
For the first 5 days, it was just major headaches and body aches. And then there was the following weekend, the fever and the pains really set in.
I couldn't believe it, to be honest. And I think when we did feel sick for those first few days, that wasn't even on our radar until we had heard that we had come in contact with a couple people that also tested positive. It's when we started to take it more seriously. And I think the biggest concern for both of us is, well, Justin was still going to work and I had been into work one day. My concern was that maybe I spread it to someone that was more vulnerable.
I had a lot of people reach out that were a very similar age, and a lot of them were experiencing very minor symptoms. And that's why I think it's super important to stress the point that, you don't stay inside to not get it, you stay inside to not give it. And I think that we really need to follow that rule a little bit more.
Anyone can be affected. Like, this virus doesn't discriminate. And unfortunately, we even have friends that are our age and they're on ventilators now. So Although you may think you might be immune, and it's possible that you could have it and have no symptoms. But the fact of the matter is if you're out socializing and you come into contact with, say, your grandparents or someone that's a little bit more vulnerable, they might not be as lucky.
With not much to do under quarantine, many are turning green. After the break, the spring resurgence of home gardening and growing.
After COVID-19, everybody wanted to see into a spot like where our ancestors would have been. So like it keeps you like very calm and it's therapeutic.
There has been a lot of tension with the U.S. lately over medical supplies it ships into Canada. But as Chris Glover tells us, the American city Detroit relies on Canada to provide the most crucial thing in fighting COVID-19, healthcare workers.
Windsor's Jeffrey Rowe works as a respiratory therapist in the intensive care unit at a Detroit hospital. Saving patients from COVID-19 has doubled his workload and stress level.
It can be tense. And at the end of the day, if you've done that 2 or 3 times, or 4 times, or 5 times, you are wiped out.
Normally, he says he's not a crier. This week has been different. Seeing support from Canadian border guards was finally what broke him.
Just went right to my heart, and I started weeping. And it was just such a cool shot in the arm that got my spirits up.
His hospital just lost its first healthcare worker to the virus, a nurse in her 50s. More than 700 other staff tested positive. With many American hospitals like this one in New York City overwhelmed, Detroit is preparing to be next, with a similar amount of cases in the city as the entire province of Ontario. Under the advice of Windsor's medical officer of health, workers at more than one hospital must choose only one to prevent spreading between facilities. Of the 70 or so in Windsor who work part-time at both a Canadian and an American hospital, just over half picked Canada. Still, roughly 1,600 people in the Windsor area work exclusively at American hospitals. That cannot stop, says Windsor Public Health.
We understand the risk that comes with going to there. We're not abandoning those people.
This weekend, a diplomatic row boiled up over potentially stopping American respiratory masks at the border. That problem was solved late yesterday, but some feared the dispute might encourage a hard stop at the border, even to essential workers.
It would be a huge failure if it gets to that point.
Jeffrey Rowe says every life he saves matters, whether it's a Canadian or American. Chris Glover, CBC News, Toronto.
Ford Canada is shifting gears in Windsor. The engine plant is now making face shields for healthcare workers. Thousands have already been made, and Ford Canada wants at least 100,000 of them made in this initial run.
It's not much to it, but this thing will save lives and help hundreds of thousands of people. So it's very important. Picture training centers. We have large training rooms in the facility at Windsor Engine Plant. And they've put workstations that are separated between 10 and 15 feet apart, between 2 or 3 a minute they're making per employee. So they're doing a heck of a job. I was in there today actually watching them do the work. We always talk about the importance of the industry being in our communities for financial reasons. But here's another reason why you need industry in your communities. In situations like this, where they're helping us, this industry, along with the workforce, coming together to make these shields and to take care of this community. When you think about we can do something for those workers, I couldn't even imagine. They're sacrificing their lives every day, and we get the opportunity to do something for them is absolutely wonderful.
Are you coughing and sneezing right now? Do you have a sore throat? I do, and at this time every year, because those are the signs of seasonal allergies. But all those symptoms are also now associated with COVID-19. So how do you tell the difference? We are joined now by Dr. Jason Lee. He's a specialist in clinical immunology, allergy, and internal medicine with his own clinic here in Toronto. Thank you for joining us, Dr. Lee. Now, apart from the symptoms I just mentioned, what other similarities do allergies and COVID share?
Yeah, it's a very interesting time, Dwight, and thank you for having me on your show. You know, the big grain of salt that I want to say is that there's a wide spectrum of presentation for both allergies, COVID, seasonal flu, and cold, and other respiratory infections. So they do share a lot in common, including coughing, as you mentioned, runny nose, and, you know, from what I read, COVID doesn't have that much in terms of congestion. But there are also distinguishing symptoms as well that can maybe help you kind of triage yourself into what you may or may not have. So typically patients with allergies know about their allergies. They've had them for a number of years, and they fall into a specific seasonal pattern. And generally, they can correlate their symptoms with a specific month of the year. You can also go a step further by looking at pollen reports. So right now, Dwight, in Toronto, we have a very high level of pollen, of tree pollen predominantly. So consistently, if you have a tree pollen allergy, you'll typically experience symptoms around March. And so this flipped over in early March, and now we're kind of in the thick of tree season. The main symptom that I think people need to ask themselves, though, if you're having or trying to differentiate between COVID-19 and an allergy, it's basically, do you have a fever? And if you have allergies, Yeah, allergy should never be associated with a fever. So fever may mean you have an infection, and whether it be COVID-19 or coronavirus, or seasonal flu, or the common strains of cold.
You've been in favor from the beginning about people using masks. I want to get this question in there before we run out of time. Yesterday,
Okay.
Canadian health officials changed their tune about this. Is it too late? What's your stance on this, Dr. Lee?
Okay, so it's a very controversial thing and here in North America. But I feel that parts of the world where they've interpreted the evidence a little bit differently have been a proponent of masks for all. And I understand there's concerns right now with not enough personal protective equipment, or PPE as we call it, for frontline healthcare workers, which is a very legitimate concern. But I have, my take on listening to the advice from the Ministry of Health in South Korea, for example, and their top infectious disease doctors, is that masks for all is protective. And, Dwight, I will say, even if they're wrong, what is the harm in having the population wear homemade masks, which are fairly easy to create? I'm not advocating for taking supply away from healthcare workers. I'm advocating for, covering up so that you can't transmit to others.
Yeah, good point. Appreciate your time, Dr. Lee. And the big takeaway, if you have a fever, it is not your allergies. Dr. Jason Lee is an allergy and immunology specialist here in Toronto. Thanks, Dr. Lee.
Thank you.
As it gets nicer out, it seems more people than usual are gardening. Seed suppliers say they're busier than ever. And it's not just people with backyards getting into the game. Alicia San has that story for us.
When the going gets tough, the tough get growing.
This is not something that's totally new for us either. If you look at both world wars, the victory gardens where more and more people use their front lawns wherever they could to grow food.
So this week I spoke with seed suppliers across the province, and they're all struggling to keep up with the demand. People are doing some serious gardening right now. So I spoke with new and experienced green thumbs to find out what you're growing.
I can actually show you it.
This Pickering High School student has made gardening a personal project since school's been out.
But this is the onions. Some tomato plants spread all over. It gets you into a spot like where our ancestors would have been. So like it keeps you like very calm, and it's therapeutic.
Luckily, he ordered his seeds online before the rest of Ontario had the same idea.
And then I realized that after COVID-19, everybody wanted seeds.
Hello! These are kale seedlings that we were just planting a few minutes ago. And so these are ones that we're going to share with our friends.
This family in East York is growing a sort of modern-day victory garden. The homeschooling that's come with it is a welcome offshoot.
One of our math lessons was calculating the planting schedule for these plants. And now soon we'll be able to start digging in the ground and getting them to, for some exercise, turn up the soil.
If you don't have the luxury of a yard or the ability to build yourself an indoor greenhouse, there's easier ways to grow things like lettuce.
I just used a raspberry clamshell out of the recycling bin, little bit of container mix, sprinkled about a half of the package in this case, close the clamshell, put it under artificial lights or a windowsill, and they sprout very, very quickly. A great project for kids, and you can start these about every 5 to 7 days.
My dad, who is much more of a green thumb than I am, sent me a little package that he found. You just basically add the seeds and water, and I have radish sprouts.
I mean, look at the smile on your face.
I know!
It's connected you to your dad. And I look at some of the most important things and lessons I've learned from gardening, and they're literally from people like my grandmother or my mother. Might get a little bit emotional here. Single package of seeds can go a very, very long way.
Alicia Chiasson, CBC News, Toronto.
Thinking about what I can grow this year, maybe some more kale, some spinach. I'm listing all the healthy stuff because I think my wife is watching, but great time to get in the garden.
Oh, yeah, absolutely. Rhubarb is another favorite of mine. So I love seeing Paul Zammit there, too. And by the way, anyone, if you follow him on Instagram, he posts just lovely pictures of the buds coming out of ground. Just beautiful photography there. So great to see our friend Paul. Now, I want to point something out here to you. We do have some colder air that's coming in a little bit later this week, but what I'm going to make you a promise. And that promise is that colder air will not be as cold as the record low for this date in history, minus 17.2. That was in 1972. I feel pretty confident about that because that's actually the extreme record low for the entire month of April. Can you imagine that? We're not dealing with anything like that, and I'm very happy about it. This morning, 7 a.m., we were at 4 degrees, a little cooler in Oshawa. We're right at freezing, but then the temperature spiked just over 13.5, so we'll round that up to 14 degrees, and then as some showers have moved in, we're down at 9 degrees now. That's been kind of the progression as these rain showers have moved in, then we get into some breaks, more to come and kind of get a little more organized into the later evening hours, and then overnight some fog development as well, so look out for that. I want to keep mentioning that for our frontline workers or shift workers who have to be out on the roads through the overnight hours or early morning, reduced visibility potential, and then some lingering showers tomorrow morning, and then that system moves through. That's kind of the weaker one. The more extensive one is going to come Wednesday night. Now, in the middle part of the day, we may get some nice clearing there and see some sunny breaks and more sunshine for southwestern Ontario. It's later Wednesday night when this front will go through with some more significant rain pushing through with it. By the way, tonight, a thunderstorm, not out of the question. It gets windy, though, Thursday behind the system, cooler, and in some higher elevations, maybe even into the GTA, a flurry is actually possible. We could have some flurries in our sky. You know, last night I was showing that on average, the month of April, you see between 4 and 5 centimeters of snow. So it's not really out of the question that early in the month we might get a little bit of a mix coming through, and then even some lake effect because of those windy conditions in those areas prone to it. Well, overnight tonight, these are our lows. We should be around -1. Instead, look at how mild they are. There are those few isolated thunderstorms, that potential denoted, and that fog as well. But I want to show you what happens when that next front comes through, the stronger one. So though tomorrow is still mild at 14, then we go into Thursday with those windy conditions. 8 will be the high, closer to seasonal, frankly, but an overnight low at 1, and that's where we could get into some of that mixing. And then Friday's high just 6 degrees, still probably pretty breezy Friday, by the way. Looks good at the beginning part, and that's Good Friday, of course, of the weekend. Easter Sunday, though, late in the day towards Easter Monday, Dwight, is when we're likely going to see some rain coming back at us once again. But the Easter Bunny's official, remember?
Yes, it is. Thank you for sharing that with us. Thanks, Colette.
You're welcome.
This weather update is brought to you by Fairmont Le Chateau Frontenac, the best location for your next spring break getaway in Quebec City.
The British Prime Minister's condition is set to be stable today. Boris Johnson was moved to intensive care last night when his COVID-19 symptoms worsened.
He's receiving standard oxygen treatment and breathing without any assistance. He's not required any mechanical ventilation or non-invasive respiratory support. He remains in good spirits.
Johnson had asked his Foreign Secretary, Dominic Raab, to take over many of his duties where necessary. The illness has killed more than 6,000 people in the UK, which now has recorded nearly 56,000 cases. For the first time since the outbreak began, mainland China is reporting no new deaths and a drop in new cases of COVID-19. And in an easing of emergency measures, Wuhan, China's worst hit city, lifted its lockdown after 76 days. But health officials say that 0 cases doesn't mean 0 risk. 66 new confirmed infections have been reported across the country today. So far, China has had more than 83,000 cases with over 3,300 deaths. And remember, you can find the very latest coronavirus updates from around the world and from right here in the GTA. Just head over to cbcnews.ca.
Thank you, Ro. There is value in these motels. My family and I have been staying in a motel for the past 3 years.
It's time to say goodbye to the Roses. Tonight is the series finale of Schitt's Creek. We'll get you ready for the big night next.
Have a very pleasant stay.
What is happening?
I once dated someone who left me for a stuffed animal. I'm not having my big day, our big day, compromised because Alexis wanted to chill in a tankini for 6 months.
Who's excited, huh?
Huzzah.
Have a very pleasant stay.
If you've been binging Schitt's Creek at home lately, hopefully you've got caught up in time for tonight's series finale. The show's 6th season run is coming to an end. Yelena Azik joins us now to talk all about it. And Yelena, this Canadian show has gained international attention over the years. What do you think this show's legacy will be?
Man, oh man, Dwight, 6 seasons, and it's really this fine balance between good-natured humor that the whole family can watch, but also pushing some boundaries. When you think about Dan Levy's character, this is someone who identifies on the show as pansexual. He has a relationship with a man. They're open, they're comfortable, and they're funny, and it's very heartfelt. I'm going to give you a listen to Dan right now in his own words as he describes his feelings about this show.
So much of us are turning to entertainment to lighten the load a little bit, and I think for our show to offer the kind of joy and happiness that it does, it's a very joyful show. It's a show that's, you know, really about the power of community and the power of acceptance, and I think those are messages that mean more now than ever before. So in a way, I feel really happy that we're able to provide a kind of temporary relief for people, and the fact that it happens to be the last few episodes of our show is bittersweet.
I think young Mr. Levy is correct. This is the type of show a lot of people need right now. So, Yelena, talk a little bit more about the desire for good-natured comedy like this during these times.
Yeah, it's no question, Dwight. With so many of us, we're just at home and we're looking for different shows to watch or spending time with our families. And yeah, this is a show that kind of helps with the balance in life and bringing some levity. And when you think about the various characters, it's really interesting because we have a show that's about the haves and the have-nots, but we've set it up in such a way, they have set it up in such a way that no one is really being mocked outright. You know, they said that they set out to create a show, this is Dan Levy and his father, Eugene Levy, where there is no homophobia, there is no racism. Of course, it's a fantasy world, but they say that if you can just give that for half an hour, then people could think that, wow, what would life be like if that was to be possible? I'm going to give you a listen right now to Annie Murphy. She plays Dan Levy's sister on the show, and she kind of echoes that sentiment.
The show is funny, but it's not humor at anyone's expense. And it's thoughtful storytelling, and it's kind storytelling, and I really hope that it can kind of be a model going forward to promote more of that. I'm going to be armed with many boxes of Kleenexes for the finale.
Kleenexes for a comedy, Dwight. And, you know, I have to mention that since this show started, it's 6 seasons now, but it really was, of course, originally on CBC and still airs on CBC, but it was propelled internationally a lot when it ended up getting on Netflix. That was in 2017. And as we've been talking about, they've got numerous Emmy nominations and just a lot of critical acclaim. And Mariah Carey, she says she watches NBA stars. Steph Curry says he's a big fan. So, you know, a lot of people around the world are pulling for them, especially tonight. The final episode airs on CBC at 8 p.m. Eastern Time. And I wanted to mention that right after that airs, they're going to do a really cool kind of documentary style kind of show where it takes you more behind the scenes and the actors talk about what it's been like to be on this show. So yeah, this is really fun. And by the way, if you haven't been watching or aren't up to date, it doesn't matter. Watch it anyways, because a lot of Canadians will be watching all at the same time at 8 p.m. And then you can always pick up later and watch. It is a little bit of a storyline that continues, but a lot of these are standalones, and they're just really meant to make you feel a little bit lighter in life and have a little bit more joy.
It really is a true Canadian international success story. Thank you, Yelena. Thank you to hubby for playing cameraman at home for us today. Maybe next time we can get the kids involved. We'll figure something out. Thanks,
We'll
Yelena.
get the whole family in the shot.
Yes, ma'am. Thank you. After the break, today's frontline hero. Stick around for that. We'll be right back. Fighting the COVID-19 pandemic one pizza at a time. Dino R.A. is the owner of Dino's Wood Burning Pizza in Toronto. And over the last few weeks, he says he's given out more than 1,000 free pizzas to hospital workers, police officers, and firefighters. R.A. is today's frontline hero, part of a series here at CBC where we give a shout out to workers helping out during the COVID-19 pandemic across the GTA. And his work is certainly being appreciated.
The nurses from Trillium Hospital and the COVID clinic want to thank Dino's Pizza for donating to us today. Thank you so much, Dino.
Thank you so much, Dino. Hi, I'm a healthcare worker, and I'm so grateful for Dino's Pizza for giving us pizza, and hopefully we'll come back soon.
We know this difficult time everybody is going through, and everybody is sacrificing, and the most sacrificers are the people who are front line. I think in this difficult situation, we should build bridges through our hearts, through our humanity. We should help each other.
Don't worry, guys. As long Dino's Wood Burning Pizza is open, nobody stay hungry.
Now, with rent to pay, RA says the financial burden is getting a little hard to manage with huge demand for the free pizzas. He had to stop allowing walk-in requests, but he's still willing to personally deliver a free pizza to hospitals in need. Thank you for everything you're doing, RA. If you'd like to share a story about your frontline hero, send us a selfie-style video explaining why they are a hero to you. Just email us at torontotips@cbc.ca, tag us on Twitter or Instagram @CBC Toronto, or send us a message on Facebook. We're all in this together, Colin.
Yes, we are, and I love these stories about our frontline heroes. And in fact, I'm going to direct this forecast to those of you, because so many of our healthcare workers, our shift workers, may be traveling at night, or our other essential workers, transport drivers that are driving through the night, even those maybe you're cleaning a healthcare facility, and so you also have to be out on the roads in those hours when some others aren't. Well, the conditions are such that we have the showers this evening, some isolated thunderstorms not out of the question, but what I really want to bring your attention to is that there is the risk of some fog. I think we'll see some fog developing overnight tonight and lingering into tomorrow morning, so some reduced visibility on those roads. It's already dark, so you have to deal with that. So just take it a little bit slower if you possibly can, and a little cautious through the overnight. The low will be 5s, a few showers in the morning hours, then some clearing, and still mild tomorrow for one more day, 14 the high, Dwight.
Thanks, Colette.
You're welcome.
That is our show for tonight. Thank you for joining us. We'll see you back here tomorrow at 6. We leave you with a siren salute from Toronto firefighters, the healthcare workers. Listen, those frontline heroes deserve all the praise they are getting. Have a great night, everybody.